Yep, stand by. This is your 1 minute warning. Stand by.
Good afternoon. I want to take just a few minutes to speak to the Maine people before I go back to the business of running the state in these most difficult times. Today marks the first day of the first stage of our state's reopening. Today, many people will be able to receive health care for certain medical needs for the first time in weeks. Important procedures that have been long postponed. This is a critical change that will support the health of Maine people and provide a lifeline to rural hospitals and clinics on the brink of bankruptcy. This weekend, Maine people can also worship with members of their faith safely under new guidelines, and others may seek relief from the stress of these times with a round of golf. Today, businesses such as barbershops and hair salons can, with strict health and safety protocols, choose to open their doors to customers and staff once again. And we trust them to know whether they can operate safely under the new guidelines. And if they do not yet have the equipment or protocols they need, or simply do not feel safe reopening, they should not reopen, and they don't have to. And if you need a haircut, please make sure that your hairdresser or barbershop is complying with these guidelines. We want to keep you safe. These are important and meaningful first steps towards creating a new normal, a different way of doing business, shopping, traveling, and enjoying the Maine outdoors in ways that will keep us all safe. If we all pull together and follow the rules that are based on fact and science. We introduced these changes earlier, and there have been a lot of questions, and that's to be expected. We will keep working to answer those questions one by one and to address especially the needs of small businesses who are striving to survive in this new pandemic-driven economy. We've said from the beginning that our plan is a flexible document, that we are always open to constructive dialogue from all workers and businesses, lawmakers and members of the public, and that is still true. In the meantime, I know many of you are frustrated. Some say they're frustrated that the state is moving too slowly. They worry about the financial toll on summer tourism that is so vital to our state's brand and to our financial well-being. Some people say they want to go back to work, but they're afraid of having to deal with the public, including millions of people from out of state who usually come here every summer, many from Boston, New York, New Jersey, and other dangerous hotspots. And some are engaging in partisan political chatter over this pandemic. But we know that the virus plays no favorites. It doesn't care whether you're a Republican or a Democrat, a Green or an Independent, unregistered or unenrolled. It doesn't take political sides. It is an equal opportunity destroyer. Other people say they are frustrated that we're opening up any businesses at all because of so many people in our state who are older or who have underlying conditions or both, things that put them in the vulnerable category, putting their lives in grave danger whenever and however this virus spreads. They read the newspaper. They read that more than 3,500 people have died in Massachusetts from this painful virus. More than 18,000 New Yorkers lost their lives. More than 7,000 in New Jersey. 2,257 in Connecticut. and in just the last 24 hours, the state of Georgia has reported more than 1,000 new virus cases. I hear all of this. I hear all of you. With every order I've issued, every action I've taken, I have thought long and hard about how Maine people and Maine businesses will be impacted. These are some of the most difficult decisions any governor has ever had to make, in consultation, of course, with the people and the businesses affected, but always with the public health as our first priority. The challenges this dangerous pandemic poses to us and to our state are unlike anything we've ever seen in generations. And in threading the needles every day, in finding that delicate balance between saving lives and preserving livelihoods, I'm reminded sometimes of what H.L. Mencken said. He said, "There is a single solution to every problem. It's simple, quick, and wrong. There is no simple solution here. No one size fits all. We cannot flip a switch and open up all the restaurants, all the bars, all the souvenir shops, and the motels across this state to do business as usual and risk an aggressive resurgence of this virus that will only sicken our people, destroy lives, and devastate our entire economy for years to come. I believe strongly that the vast majority of business owners across Maine, though they're frustrated about being closed and concerned about their future and having difficulty with the congressional benefits, I believe that they share an unflagging commitment to keeping Maine people healthy. I ask them all to stay the course, continue talking, continue listening, continue being part of the solution. And we cannot just remain closed. There are activities that we can do safely now that will allow our economy to begin to function again. I wish I could tell you all when this pandemic will be over, but I can't. If I gave you a simple, quick, and easy answer like that, it would be wrong. Because this pandemic and all of its impacts, it's extraordinarily complicated. So let me tell you what we are doing. First, unlike some states, we have from the beginning allowed construction, industrial manufacturing, fishing, home repair, pharmacy, auto repair, child care, banks, laundromats, veterinary clinics, farming, and a number of other essential services to continue as usual with precautions. And we are collaborating with others from all economic sectors across the state to prepare them too to open as soon as they can and as safely as they can. I'm well aware that the current timetable puts a crimp in the ability of many businesses to rehire, to retool, and to take reservations from vacationers and others who want desperately to escape to our state in June, July, and August, to enjoy the beaches, the mountains, the lakes and rivers and fields of this wonderful place we call home. First and foremost, in order to expand business further and to prepare for the tourist season, we need more testing capacity. And we're working every day on that critical issue. Expanding testing will give us a better picture of how widespread the virus is now in our state and help us prepare in a measured and thoughtful way for an influx of people from out of state in the coming months. We are constantly reevaluating the plan we've put forward with input from all sources to adjust it and to safely restart our economy. And as we start this next stage, as we talk about reopening, there will be a lot of debate, and I welcome that. That's how the process should work. There will also be a lot of frustration, some winners and losers. I understand that too. And yes, there is anger, and I share that too. But let's keep talking. This virus is testing the limits of our patience, the limits of our economic stability, the limits of our state's health and endurance. In this, our 200th year, let us stand up to show the world who we are. Let's show them that no matter the challenge, no matter the difficulty, we will persevere. And let's keep talking. Our enemy is not anger or fear. Our foe is complacency. The people of Maine have proven in the last 6 weeks that they are courageous, patient, and compassionate, that they value the safety of our frontline workers and first responders, including the 253 brave healthcare workers who have been stricken with this virus. And the last thing any of us should want to do is to overwhelm the healthcare system and put these brave people more at risk or take their valuable lives. It is because of your actions, and uniquely because of your actions, that the virus has not destroyed us, that we have, so far, kept a measured lid on this insidious disease. Day before yesterday, 252 people died in one day alone in Massachusetts from this virus, a state only 15 miles from our border. I will do everything in my power to make sure that this deadly and untreatable virus does not hop a plane, a bus, a truck, or a train, or an SUV, or an RV, and land in our state and take over our state as it has taken hold in others. So let's work harder than ever in these next few months to keep this thing at bay and keep our people and our economy safe. We can do this because I believe in you, in the faith, ingenuity, and willpower of the people of Maine. I believe in our great state, and I will do everything I can to save it. I'm not a quitter. Maine people are not quitters. People are angry and frustrated, some losing patience. But no matter what, I will keep hearing you. I will keep listening to you, and we will listen to each other. We will work with each other. We'll do everything in our power to keep each other safe. We will not give up on each other, never quit each other, and I will never quit you. Now I am headed back to work for the people of Maine, and I will leave you in the good hands of Dr. Shah. Thank you, sir.
Thank you, Governor. Thank you very much, Governor Mills. Good afternoon, ladies and gentlemen. Thank the Governor for joining today. My name is Nirav Shah, and I'm the Director of the State of Maine Center for Disease Control and Prevention. Here today to provide an update on the public health side of the COVID-19 outbreak across the state. And we begin today, as we have on so many prior briefings, on a somber note. Maine CDC is reporting the passing of 2 additional individuals with COVID-19. One was a man in his 40s from Waldo County. The other was a woman in her 80s from Cumberland County. These 2 passings mark the 54th and 55th deaths, respectively and respectfully, of Maine people who have passed away with COVID-19. We continue to offer our deepest condolences to the families of these 2 individuals and all of those who have passed with COVID-19 during this time of their grief. Overall, Maine CDC is now reporting 1,123 cases of COVID-19 across the state, representing an increase of 28 cases since yesterday. Of those cases, 177 have been hospitalized at some point, an increase of 7 since yesterday. Right now in the state of Maine, there are 37 individuals in the hospital with COVID-19. 17 of them are in intensive care unit beds, and 20 are in non-intensive care beds. And 9 individuals are on ventilators. That's an increase of 1 since yesterday. Overall, 657 Maine people have recovered from their bout with COVID-19, an increase of 26. There are no new outbreaks to report today. There are, however, new cases to report that go along with those outbreaks. Indeed, of the 28 new cases, 8 of them are outbreak related. All of those 8 are related to outbreaks at long-term care facilities and other congregate living settings, and I'll get to those in a minute. As Governor Mills noted, there are now 253 healthcare workers across the state who have now been diagnosed with COVID-19. I wanted to, before we turn to the long-term care piece, go back to 2 points that we discussed yesterday. The first was a question that was raised about swabs that we are receiving on an ongoing basis starting May 4th and every week thereafter. And I can confirm today that some portion of those swabs will be coming from the Puritan manufacturing facility here in Maine in Guilford. That was a question that was raised yesterday, and we confirmed that, again, some fraction of those 15,000 of the swabs that we will be receiving on a weekly basis will be from Puritan. The second question that I wanted to clarify today is with respect to quarantine for individuals from other states who might be coming here. Our expectation and our anticipation is that any individual coming to Maine from another state arrive and be in a position to fully quarantine for 14 days. This means bringing with them all the provisions that they may need for that 14-day period. That's our expectation, and we hope it's one that is abided. I'd like to quickly provide an update on a number of the outbreaks that Maine CDC is tracking and working with colleagues across the state on. At the Augusta Center for Health and Rehabilitation, there are no new cases. At the Edgewood facility, similarly, there are no new cases. At Augusta Rehab, that number is 76. At Edgewood, the number is 14. At Falmouth by the Sea, there are 6 additional cases of COVID-19. At the Hope House facility in Bangor, there are the same number of cases as yesterday, 21. No new cases there. At the Maine Veterans Home in Scarborough, there are 2 additional cases, bringing the total to 53. At Tall Pines and the Cedars, there are both no new cases in either facility. 43 cases at Tall Pines and 15 cases at the Cedars. And at Tyson Foods, there are now a total of 11 cases affiliated with Tyson Foods. A quick update on Tyson Foods. We've been working very closely and collaboratively with Tyson Foods ever since the conditions constituting an outbreak were first identified. Tyson Foods is planning on following Maine CDC's recommendation to conduct universal testing across all the employees at the facility. They're also planning to idle the facility for a period in order to conduct deep cleaning. I'd like to provide next a quick update on our fulfillment of requests and orders of PPE. Today alone, there are 33 orders for PPE that will be delivered. Roughly 80% of those orders are going to congregate care settings, specifically to nursing homes. And the remaining 20% are going to first responders at the local level fire, EMS, and rescue agencies. Overall, and at present, I'd like to just quickly review the overall PPE inventory at Maine CDC. As of right now, we have on hand approximately 177,000 N95 masks, 92,000 surgical masks, approximately 12,000 face shields, about 1.1 million gloves, about 1,300 disposable protective suits, about 3,500 surgical gowns, and about 1,000 swabs on hand, nasal swabs. And as I've noted, we'll be getting a regular shipment of those swabs starting early next week. Overall, Maine CDC has now fulfilled about 1,350 orders for PPE across the state. And finally, in terms of the vital assets across the state, there are a total of 330 ICU beds, 171 of which are available. There are a total of 316 conventional ventilators, 290 of which are available. And overall, there are 397 conventional ventilators available across the state. Before I turn to our colleagues in the media for questions, I just wanted to share a quick observation. It strikes me that, and perhaps many of you have noticed, that things that were commonplace even 90 days ago are almost completely unheard of today. Packed stadiums, crowded conference halls, bars packed to the gills. Those were scenes that were normal and a part of everyday life just a few months ago. And now, even to think back on those days causes many people to recoil with fear. Similarly, the opposite phenomenon has happened. The way that we live our lives today and the measures that people in Maine have undertaken with so much gusto would have seemed unfathomable 90 days ago, and yet here we are, and they seem almost obvious, so much so that they now seem in retrospect to have been inevitable. I mentioned yesterday that curves don't flatten themselves. Viruses just don't disappear, and epidemics just don't go away on their own. All of those things happen because each and every one of you has taken the steps that public health folks across the country and across the state have recommended. You are the ones that have made these fundamental changes in your lives, from going to stadiums and conference halls to bars, to staying home and helping to stop the spread of the virus. It's because of you that we've been successful thus far at flattening the curve. And I would again like to take a moment to thank everyone and acknowledge this fundamental shift in the lives that each and every one of us leads. And just please know that as you go about staying inside, as you go about heeding this call to inaction in some respects, please know that you are doing so for the sake of the greater good, but that your shared sacrifice is not one that is going unacknowledged. I'd like to take a moment right now to acknowledge that shared sacrifice and thank each and every one of you for helping us flatten the curve. So with that, I'd like to turn things over to our colleagues in the media. Today's first question goes to Alyssa Thurlow over at WABI.
Hi, Dr. Shaw. Thanks for taking the question. My first one is, do you have an update on the firefighter in Waldo County? And also, we got a question from a viewer about, when people are exercising outside, should we maintain distances much greater than 6 feet? I know there's some concern about risk associated with exercising, on busy streets, busy roads, where people may be driving by with car windows open, as the warmer weather arrives.
Great. Thanks, Alyssa. So Alyssa's first question involves the tragic passing of a firefighter in Waldo County. Our thoughts and prayers go to his family during this time of grief. Alyssa, what I can tell you right now is that our investigation is underway. We've made contact with many of those individuals that are involved from a public health perspective. Unfortunately, for reasons of privacy and to respect the family right now during this time of their grieving, I'm not able to comment anymore, but please know that we found this passing to be quite tragic, and we again offer our deepest condolences to the family of this individual during this difficult time. With respect to the question about outdoor exercise and whether a greater radius of 6 feet should be recommended, There is some suggestion out there that while you are outside exercising, more than 6 feet would be required. The US CDC has not made any official pronouncement about this. So what I would offer to everybody is as follows. When you're outside, especially when you're exercising, try to maintain as much distance as possible from the other people you're exercising with. Now, if you're going out for a jog with your roommate or your partner, you may not really want to be 20 or 30 feet away, in which case the 6 feet margin is acceptable. But if you're part of a running group, or certainly if you're out by yourself on a trail and you know that there are other people there, try to maintain as much distance as possible from other folks. In some cases, it might be 6 or 8 feet. In other settings, 20 or 30 feet might be possible. As much as you can maintain, the better. Thank you for that question, Alyssa. We will turn next to Michael Fern over at the Maine Edge.
Thank you, Dr. Shaw. I had a question for the governor, but I guess I'll ask both of you. There are reports across the country that some mental health centers and state CDCs are concerned that the ongoing lockdowns are causing mental health issues and suicides are likely to increase. I think a lot of this was reported yesterday, especially with teens who are more in need of socialization. Do you share that concern that the care might end up being worse than the virus for this age group? And are, in fact, suicides and mental health issues, in fact, rising across the state? And the other question has to do with businesses who are sending us questions. The most common theme we're hearing is most assume that this was going to be a 30-day pause to help flatten the curve according to both federal and state guidelines. Now businesses do feel that the goalposts have moved again, as it appears this is going to be a 5-month stretch. With Maine experiencing a lower mortality rate than other states that are opening up sooner, how is there still justification to keep these businesses locked down for so long?
Sure.
Thank you.
Thanks, Michael. So your first question involves mental health. You framed it in a way that I want to be very clear about. You asked if I thought that the cure is worse than the disease, and I don't buy into that characterization. There are tens of thousands of people across the United States, over 50 people in Maine who have passed away, and so I just want to make sure we recognize that many, many people, our friends, family members, people in our community have passed away, not just in Maine, but across the country. However, Michael, I do definitely share the concern you raise about the mental health implications around coronavirus. What I think it speaks to is a broader concern about the various ways in which coronavirus will echo across the state, mental health being just one of them. During these meetings, we've talked about my concerns around social isolation, loneliness, impacts on individuals grappling with substance use disorder, and as you note, depression, and the possibility of suicide being among them. We are concerned about that. Director Jessica Pollard of the Office of Behavioral Health and I have discussed this issue and this concern on numerous occasions. That office has taken separate and independent steps in conjunction with our broader work to try to anticipate what might be coming down the pike and make sure we offer services. And we've done so. We've made sure that our helplines are easily accessible, that the counselors who staff those helplines have training in how they might grapple and help people specifically contending with concerns around COVID-19. And we've taken it to make sure that healthcare workers have a line that they can call as well. We've also made sure, specific to substance use disorder, individuals who, for example, may have been receiving methadone treatment, still have a line to make sure they can get those treatments, not just in the normal day-to-day, but especially if they need to, for example, be placed in quarantine. Nevertheless, despite all those measures, our concern level remains high. And if you happen to be watching right now, and you are feeling like things are helpless, feeling as if there is no hope, and feeling as if you personally may not come out of this difficult time, please, please reach out for assistance. And know that there are people who are standing by to help you. And know that you are not alone. You need not go through the coronavirus situation by yourself. We will get through this. And there are people standing by to help us with that. Now, Michael, you also asked about the continuing rationale for keeping certain restrictions in place. And I think we need to look no further than what other states have already and countries have already started experiencing with respect to reopening. Starting several weeks ago, there started being reports published in the literature about the experience in places like Singapore and Hong Kong that started quickly moving to reopen and inevitably and invariably saw a significant spike in cases. Just yesterday, the state of Georgia reported over 1,000 cases of coronavirus in a single day. We also need look no further than pictures that came out of Orange County, California over the weekend of beaches crowded with folks no more than a couple of feet away from one another. So I think, Michael, although the curve has started to flatten, and although there are glimmers of sunshine that are out there, we are still very much in the thick of things, and the possibility, the risk of a resurgence in the number of cases is still very much with us. Now, although healthcare capacity is robust, and that's a good thing, that situation can still change. And so that's why Governor Mills believes that this staged reopening is the best way to mitigate any concern about a risk of a resurgence. And that's not based on speculation. It's based on the experiences of other countries that reopened and invariably saw that spike of cases. I'd like to turn next to Steve Betts over at the Courier-Gazette.
Thank you, Dr. Shaw. I know that you have repeatedly said, assume that the virus is in your community, even if there's no reports of one. I guess the question people have been asking me, why quarantine people from out of state who are coming into Maine for 14 days when we don't quarantine people? Say if someone from Bangor wants to drive to Rockland, there's not a quarantine. Just wondering what the rationale is behind that.
Sure. The basic rationale, so Steve asks about the rationale for quarantining individuals, asking individuals who are coming into Maine from other places to quarantine for 14 days, and why we don't do that for people who, say, might be wanting to go from Portland to Rockland or Portland to somewhere else. And the answer, Steve, comes down to the fact that the rate of disease in just about every other part of the country is significantly higher than what we have in Maine. Just to put those numbers in perspective a little bit, Massachusetts right now has over 62,000 cases of coronavirus. 62,000 cases for a state that only has 5 or 6 times as many people as the state of Maine. Again, Massachusetts has 62,000 cases and Maine has just over 1,000. So it really does come down to the differential risk that folks in other states have because of the steps that people in Maine have embraced, not despite them, but because of those steps and the way in which physical distancing has been embraced. The rate of cases in Maine is significantly lower than that of almost all of our neighbors. Certainly lower than states in northern New England, and probably lower than every other state in the Northeast. That's the rationale why others who are entering from other states, why